Good morning, everyone. It's time to go on the record.
No one disputed the 3-cent increase on the gas tax, including me. The legislature wants to raise taxes, and the governor wants to raise taxes. They should be held accountable.
A week of transportation Armageddon, just as the Baker administration makes plans for transportation cuts, among other deficit reductions.
With all the money that we pay, you think we'd have easier commutes.
Crisis of confidence. The storm, cold chills, public confidence in government.
The casino operators have come to Massachusetts making commitments in exchange for those licenses. They need to be held to those commitments.
The Bay State's new Attorney General talking tough about casinos, the Partners Hospital deal. Maura Healey is our guest this morning. And can you say validation? Despite controversy over a snowy rally, Patriots fans clogged Back Bay streets for a Super Bowl celebration.
From WCPB Boston, the inside word from Washington to Beacon Hill. Today's newsmakers are going on the record.
Good morning, everyone. I'm Ed Harding, along with Janet Wu, our political reporter here at News Center 5. Today's guest is Maura Healey. She was sworn in as the state's top attorney late last month. Prior to her election, the Charlestown Democrat was an assistant attorney general. Just days into office, she has taken on Partners healthcare expansion, the casino industry, and the further regulation of prescription narcotics. Madam AG, thank you for joining us this morning.
Great to be on.
Appreciate it.
A little less tense than last Sunday, I do have to say. You're coming off
Super Bowl's a little tense, is that what you're saying?
It was tense going in. You're coming off a big win just days after taking office. The court sided with you on the Partner Healthcare's attempt to purchase 3 hospitals. So for the average person, why is this good, especially one who lives in Massachusetts?
So what this is really about is healthcare costs. And you know, as I went around the state over the last year, I heard from so many individuals and families and businesses about the crippling healthcare costs that are out there. It's something I'm committed to working on. Attorney General Martha Coakley was committed to working on that. This was a deal that was before the court regarding Partners' desire to expand and purchase more hospitals. And in my view, in looking at the information, I didn't think that it was going to result in lowering costs. I didn't think it was going to be good for consumers. And so I let that be known to the court. Court has made a decision. And at this point, we just got to see what Partners does with the issue.
Their argument, of course, was that it would save money because they can consolidate, but they've, owned quite a few hospitals. Do you have the facts and figures to back up the fact that consolidation does not save consumers money?
Well, I think that what we've seen over the years, and this is something that the Attorney General's office, in fact, studied, looking at growing market size and power and what that then seemed to result in terms of leverage and raising costs. And so you look at that. I certainly looked at the information that was provided to the court after this proposed agreement was filed, and I just came to the conclusion that it wasn't going to help us get there in terms of lowering costs. And that's my focus. My job is to protect people, protect consumers, and in this instance, do everything I can to help drive down healthcare costs and ensure access to care.
Let's talk about the use of opiates in the Commonwealth, which in many areas it's almost crisis point. You're pushing to limit the flow and use of opiates, and your voice unquestionably is important. But don't you think most of this has to come from the governor and the legislature?
I actually I think that it can come from a number of places, and it should come from a number of places. We really need all hands on deck and everybody engaged on this issue. In fact, it's something that the governor and I first spoke about when we sat down together, and I know he's going to be and is as committed to this as I am, and I look forward to working with him on this issue. A few things need to happen. Certainly, to get at this issue. One, we need more public education and outreach in schools and for young people. We need to work with doctors and healthcare professionals around safe prescribing practices. I've heard so many stories from people whose kids got prescribed medication without being told that these are narcotics, these are highly addictive.
These are addictive, yeah.
We need to work on that. We also need to work to break down some of the barriers that exist for people looking to access care, both finding beds, but also working through some of the issues around insurance coverage. And as Attorney General, I'll have an opportunity to work directly on those issues. I also want to work with Governor Baker and the administration on building out a more robust prescription drug monitoring program. We have a system in place that allows us to keep track of who's prescribing medication, who's giving it out, and to whom. That system needs to be made more robust so that we have real-time reporting, real-time information. We can cut down on people doctor shopping and hopping from pharmacy to
And
pharmacy.
real-time checks and balances,
Checks
too,
and
perhaps,
balances.
right?
But
Sure.
a lot of this stuff has been in the purview of the legislature and the governor, whereas the Attorney General has been more of a prosecutorial role in all of this. Are you talking about perhaps pushing your authority to areas that were before legislative and gubernatorial areas instead of just sticking to prosecutions?
Not at all. Here's what I've announced, Janet. I'm going to have criminal prosecutors in the office focused on drug trafficking and problematic prescribing practices. I'm going to have consumer protection attorneys looking at what big pharmaceutical companies are doing in terms of the marketing and sale of these drugs. I'm going to work with Medicaid fraud to make sure that we are cutting down on negligent or even criminal prescribing and dispensing practices, and using oversight over not-for-profits, which is something the Attorney General has as authority. I'm going to work with our hospital systems and insurance companies to do everything we can to open up lines of service and make access to care and coverage easier. I also, as the state's chief legal officer, have the ability to work directly with state agencies and help advise as we work through these issues. So it's important that, you know, I am the people's lawyer. I was elected to this position, and this is a public health crisis that I'm going to really work hard on.
Casinos is another hot issue where you've already weighed in, and it really is a potential landmine. What's your biggest concern, and what are you going to do about it?
Well, as I've said in the past, I think I bring a healthy skepticism to the industry when you look at what's happened in other regions and parts of the country. My job is to make sure that consumers are protected, to make sure that casino operators who made commitments to communities here in this state are held to those commitments, make sure that workers are protected, and make sure that we're doing everything we can to fight off potential criminal issues when it comes to potential money laundering or organized crime. So I'm going to be active, I'm going to be present. The day after I took office, I appeared before the Gaming Commission, and I don't think that surprised people because this is an issue that I care a lot about. I think it's going to have a big impact on people's lives here in the state, and I want to make sure there's fairness and transparency in the process, and the public is protected.
I have your OTR pop quiz in my little hands here. Well, they're tired, they're not so little, but I have it in my hands nonetheless. Question, you ready?
As I'll ever be.
Okay. Question 1. Governor Charlie Baker has announced his proposed cuts to ease the deficit. About 1/3 of them are coming to what state department?
Um,
About 1/3 of them coming to which state department within the state? And it's the primary funder to universal health care, Mass Health. That's the answer we were looking for.
Okay, well.
Question 2. Last week, House Speaker Robert DeLeo successfully convinced his body to repeal term limits for his job. Now DeLeo is raising eyebrows for giving his Beacon Hill inner circle what?
Some additional pay raises.
Pay raises far above the 6% he said he was giving to the House staff last year. We continue on the record with the Attorney General. Stay with us.
Okay.